For navigation, we put the tracker on the opposite iliac crest, so that's why we draped it out here. So we make 3 little small poke holes for the tracker, just through the skin. So you find the iliac crest, and then you go between the 2 tables. Put it in a pretty good ways, make sure that it's stable. And these are pins are very similar than what we put in when we put in an external fixator for our trauma guys. And we put the ortho lock. What's important for the ortho lock is that you put it on such that you can actually tighten the screws. If you put it the other way, then you have to tighten it from over here, and that can be challenging. And we always put a 3rd pin in because we really like the stability that 3 pins give us. And it's very stable as well. And we have had very rarely a complaint by the patient on any kind of symptoms on these pinholes. Sometimes they're a little sensitive, but that is rarely a complaint. And these trackers have such a good range that it's not any issue whatsoever of where you put it to get it seen by the camera. So the camera is at the end of the arch, and we can see it quite well. Now, in order for leg length, what we do is we make a little poke hole on the distal femur, and then we use this drill. See, this is the tip that we use. It's just the same drill that we use for a distal interlocking screw. We only bury the tip, but not the drill. And that gives us a little hard stop. We put this in. Just to create a little divot. Okay. Now we go through the registration process. Table up. Good, back down. And then the left ASIS first. Right ASIS second. And the symphysis pubis. And then the distal marker, we put our gun into the hole. And I can find it real good. I'm in the hole. And that gives me a very accurate distal marker for leg length. Now, what we do just to make sure that we can find that hole again, we kind of go through the process as if we were done with doing a hip. So we register a fake socket. And do a post reduction. And of course, this should give us a reading of 0 since we haven't done an operation yet. And sure enough, it gives us 0. So we know that we can find the hole. We know that it's accurate. We know that the X is in the middle of the ML at AP dimension. And then we go back and we delete the socket registration since we're going to register again after we do our neck osteotomy. So now we're ready to start doing the operation. So in X-ray she's too short, clinically she's even, but with such a severe head collapse, we're going to put in a -2.7 ceramic head.